In order to implement value-based care, providers must find ways to emphasize clinical efficiency and improve health outcomes. Specific care management and wellness programs can be a solution in addressing this, and one example is a popular program overseen by Medicare. It's called Remote Patient Monitoring, or RPM. In this video, we'll cover how an RPM program can help your practice implement and transition to value-based care. Hey, this is Dan from ThoroughCare. At ThoroughCare, we help groups to streamline their value-based care programs through one of the many solutions that we offer. The shift to value-based care ties provider compensation to specific performance metrics in order to drive change. For example, private insurers, as well as Medicare, now use alternative payment models, such as the Merit-Based Incentive Payment System, otherwise known as MIPS, to provide those value-based care programs. In arrangements like these, providers could miss reimbursement and revenue opportunities if they fail to meet or exceed the metrics. So, how can remote patient monitoring help your practice implement and transition to this model? An RPM program can help your practice to address specific performance areas that are relevant to value-based care, including patient satisfaction and engagement, overall patient health, and clinical efficiency. If you'd like to learn more about how RPM works and its billing codes before watching this video, you can watch and learn more right here. So for now, let's dive in. The first way RPM can enable value-based care is by improving patient satisfaction and engagement. Value-based care emphasizes creating a satisfying patient experience, so patient engagement becomes important to influence health outcomes. Engagement is especially vital when it comes to preventive care. This can involve diet and exercise or disease screenings. An engaged patient is more likely to participate in preventive measures. An RPM program can help engage patients through the tracking of their numbers. The daily collection and review of these numbers through a device helps a patient focus on their health. These numbers include blood pressure, heart rate, weight, oxygen saturation, or even others. By participating in their own monitoring, patients become more engaged in their own well-being. This can help to motivate patients to engage with preventive health services and make smarter lifestyle choices. This also greatly benefits people living with chronic conditions, such as diabetes. Engagement can have a real impact on health outcomes, which can improve the satisfaction of your patients. The second way RPM can enable value-based care success is by enabling better patient health. With remote patient monitoring, a practice can easily manage chronic conditions by focusing on underlying health indicators, such as certain vitals. The continuous observation of these vital signs can help track any changes in a condition's severity as they happen. By isolating these vitals and capturing trends over time, practices can gain greater insight as to how these indicators influence your patient's health. This can guide treatments or interventions to better manage the chronic condition. Real-time data collection can help in the detection of emergency health issues before they happen. This can help reduce hospital admissions and emergency room visits. And lastly, the third way RPM can enable value-based care success is by maximizing clinical efficiency. With RPM, a practice can engage and treat a high volume of patients remotely. Patients use their devices daily in the comfort of their own home, with monthly communications occurring via phone or telehealth platforms. This allows practices to support a continuum of care by closing gaps in service and treatment without office visits. Also, RPM does not require provider time. Staff or care managers can perform nearly all of the tasks required for RPM. On average, a care manager may be able to engage 100 to 250 patients per month. Software solutions can further streamline RPM. Task automation, scheduling tools, and health data integration can increase capacity and help reduce staff workload, as well as simplify the data collection process. Healthcare analytics solutions can further promote efficiency by helping practices manage all the RPM data collected. With these insights, it's possible to better target patient treatments and optimize clinical operations. It's also possible to outsource an RPM program. In such arrangements, an outside service provider fully manages the program. This allows a practice to offer a program to patients without committing additional staff and resources. Keep in mind that RPM reimbursements can also establish a new source of revenue that can help expand capacity in other areas or support the adoption of new technology to further increase efficiency. So, as you can see, RPM can help your practice meet the performance metrics underlying value-based care, including patient engagement, the effectiveness of treatment, and clinical efficiency. Not only can it help with these metrics, but the program can also drive additional revenue through the programs. The program really is a win-win for your patients and your practice. If you'd like to learn more about RPM and value-based care, visit our Learning Center. There's links in the description below. Or if you're interested in how care coordination software can help you, then contact us at the link below. And as always, if you found this video helpful, please like it or subscribe below. Thanks for watching. Bye.